Let's talk about your pre-assessment appointment. That's the appointment that happens at our hospital. It's different from the appointment you have with your surgeon before surgery. The things that happen during the pre-assessment appointment, the nurses are going to take a detailed medical history so they know what's going on with you. They're also going to go over all of your medications that you take on a daily basis, including all your supplements. That appointment typically takes about 2 hours, so please plan accordingly so you don't overbook yourself. After the nurses go over your medication and medical history, they're going to be able to tell you what medications to stop before surgery, what medications to continue. They're also going to be telling you what medications to bring with you on the day of surgery. The things that you should bring with you on the day of surgery are all your prescription medicines with the exclusion of your vitamins, your supplements, and your pain medicine. We ask you to bring your medicines with you on the day of surgery because at our hospital, we have a pretty large formulary of medications to give you. However, we may not have the newest medication that just came out on the market that your doctor has you on. So instead of having you go without your medication, we'll give you your own. You're also going to be receiving detailed written instructions along with a bottle of antibacterial body wash along with the new body puff. It's very important that you follow the instructions exactly as they're written. The instructions go like this. 3 nights prior to surgery, you're going to use the body wash before you go to bed. You're going to use about 1/3 of the body wash. You're going to put it on the little scrubby and you're going to put it on your body from the neck down. Turn the shower spray away from yourself for a couple of minutes just to let it sit on your body. Then you're going to rinse it off. You're going to get out of the shower. You're going to towel yourself off, and I want you to put on clean pajamas. Here's where the hard work is. You're going to need to lay on clean sheets 3 nights prior to surgery. So here's my workaround for that. You're going to make up your bed just as you normally would with some clean sheets, the fitted sheet on your bed. Then I want you to take 2 flat sheets and I want you to fold them in half and lie them on top of each other. So the first of the 3 nights before surgery, after you get out of the shower and you put on clean pajamas, you're going to fold back that first of the 2 sheets and lay on top of it and fold it over yourself. The next morning, you're going to peel that sheet off, take your pajamas off, and start your day. The second night prior to surgery, you're going to use another 1/3 of the bottle. Put it on your body, turn the shower spray away from you, let it sit for a couple of minutes, and then rinse off, towel off, put on clean pajamas. Now you're getting on that second sheet. Fold it over, get underneath it, fold it on top of yourself. The next morning, you're going to take that last sheet off, your pajamas off, go about your day. The night before surgery, you're going to be using another 1/3 of the bottle, shower from the neck down, turn the spray away from yourself, let it sit, rinse yourself off, towel off, put on clean pajamas. Now you're lying on top of your full sheet set. The morning of surgery, you're going to take off your pajamas. You should be squeezing out the remainder of that body wash, showering from the neck down, letting it sit, rinse off, towel off, put on your clothes, and you'll be ready to come to the hospital. Now you ask, why all of the extra steps? Why is that so important? There are 2 things that are devastating to a total joint. That's a fall and infection. We want to do everything that's within our control to prevent any of those things happening. Which leads me to talking about your pets. We all love our pets. They're part of our family. However, your pets can help you do one of those 2 things. They can help you with an infection. If your pet sleeps on the bed with you at night, what good does it do for you to go through all of that work of making sure that you're showered and you're changing your bed sheets if you're going to get back into your bed and your pet's going to be on you and their dander is on you, okay? Also, when you're coming home after surgery, your pet should not be lying on the bed with you. Your pet dander is everywhere and you're going to have an incision that's going to be covered. However, pet dander is very, very microscopic and it can't wait to get into your new incision. How can your pet help you fall? Well, you're going to be going home after surgery and you're going to be away from home for a couple of days, and when you come home, your pet's going to be so excited to see you. So it's going to be under your feet, and then you're trying not to step on your pet, but in doing so, they're going to get under your feet and you could fall on the floor. And guess what? You're going to be calling 911 and back to our emergency room. We don't want that to happen. It's not forever. I know that everyone loves their animals, but it's really only for about 3 months that we don't want your pet to be on the bed with you. My suggestion for the transition from when you come home after surgery for your pet is that you could do one of two things. You could have them boarded, which I understand is quite difficult for some folks, or before you even get out of the car from coming home, I want your family member to come into the house. Take your pet, put him in another room, and close the door. And then you can come inside, sit down, get yourself situated, and then let your pet out. Regardless if your pet is inside or outside, it's important for your pet to be secured before you get out of the car and come into the house. We don't want you to have a fall.